Hey there, this is Dr. Credeur. I wanted to send you a video blog today because I just got through meeting with one of my diabetic patients, and he said something to me that was so compelling that I just really felt you needed to know. This is a patient I've been treating for 5 weeks only. This patient came to me on insulin. He was taking 85 units of insulin per day, and he said something to me that, out of frustration, he said, I want to tell you something. When he first began his insulin therapy, we're here in Denver, and he went to one of the big hospitals here in Denver where they have a diabetic program, and the diabetic nurse, as he said, the one who was super trained in diabetes, was showing him how to take his insulin, and basically said to him to get used to this, because as the years go on, you're going to have to take more and more insulin. And she basically said that as that was a fact of life. And you know, she was right from one perspective, because the more insulin you take, the more prone you're going to be to become more and more insulin resistant. That's one of the reasons why you see diabetics have to increase their insulin therapy as they go through life and to keep their blood sugars under control. But he's the type of person that he wasn't willing to accept that. He just really didn't accept that. He found that to be really off the cuff, that she said, you're just going to have to live with this type of injections and ongoing and increasing insulin therapy. I'm going to tell you that in 5 weeks worth of treatment, he has cut his insulin by more than 1/2, and his blood sugars now in my program are lower than when he was on 85 units of insulin. So I'm here to tell you that if you do the right thing for a diabetic patient, if you get to the underlying cause of why that person is diabetic, and you look at the physiological, biochemical, hormonal imbalances that are associated with this disease, and you customize a treatment program for the individual, we see miraculous changes. So we see people come in on insulin, they're able to eliminate completely their insulin needs, lowering their blood sugar, getting off more and more medication, losing the weight without exercise, and they do just wonderful. So I'm here to give you some hope that it does not have to be sort of a death sentence where you're just relegated to more and more insulin, more and more medications. There is another way if you find the right doctor, and we think that doctor is us because we do a really good job in looking at the individual needs and customizing it for the patient. So just a message of hope for you today, and hopefully that inspires you to move forward and take control of your health. Take care.